Hi, my name is Dr. Kerry Tapuzian, and you're watching How to Treat Intelligently. Today, we're going to talk about what tests you should have your doctor run if you have any thyroid issues. And typically, most physicians will run something called TSH, thyroid stimulating hormone. And this is a hormone that's made up in your pituitary gland, and its purpose is to monitor your bloodstream to make sure that your thyroid gland is making enough thyroid hormone. Okay, so if you're not making enough thyroid hormone, your TSH will go up, trying to stimulate your thyroid gland to make more hormone. Well, things can happen to your pituitary gland, and there's something called secondary hypothyroidism, where the pituitary gland's not signaling, it's not realizing that your thyroid is low. And things that can cause this are environmental toxins, your age, any type of head trauma, closed head injuries. There's a lot of things that can cause this to happen. So unfortunately, just getting a TSH isn't the best thing to do. But unfortunately, that's sort of like the standard of care out there, is to just get a TSH. It's basically a screening tool. What is also important to get done is to get your hormone levels, your actual hormone levels that your thyroid gland makes, which are free T3, free T4, and reverse T3. Now, your thyroid gland naturally makes about 90% T4 and about 10% T3, at least depending on the textbook that you read. Reverse T3 is specifically made only from T4, and some people call it the hormone of hibernation. But what it does is it's the evil stepchild of T3, because reverse T3 and T3, they compete with each other. Okay, they both try to get to the same receptor site in each cell in your body. Okay, so if by some chance you have a higher reverse T3, think of it like musical chairs. If you've got more guys on your side than the other team, who's going to win? Who's going to get to the chair first? Who's going to get into that receptor site in each cell in your body first? The one that's higher. So very important to check reverse T3, free T3, free T4. Okay. Also, what's important is to check your antibodies, looking for Hashimoto's or Graves' disease, which is hyperthyroidism, too much thyroid. And I've got a lot of patients, they say, I ask them, do you have Hashimoto's? And they're like, I don't know if I've ever been tested. And granted, the reason why a lot of practitioners out there won't test for Hashimoto's, and the way you test is there's two blood tests. One's TPO, or thyroid peroxidase antibodies, or thyroglobulin antibodies. The reason they won't do this is because, well, it doesn't matter. We can't treat it. There's no way to treat it. But that's bull. There really is ways to treat this, at least from a functional medicine standpoint. So it is important. It's salient to check this too, because you don't want to have Hashimoto's, which basically is your immune system is slowly attacking and destroying your thyroid gland. Okay, it's going to make it look like Swiss cheese after a few years. So good to test. You test those things, and by the way, all these tests are easy to order and test. All labs pretty much will test all these things. Another test that's important to get if you're having symptoms of too much thyroid, is TSI, thyroid stimulating immunoglobulin. If this comes back abnormally high, then you have Graves' disease. If it doesn't, then you have some other reason that's causing you to be hyper. There are some other tests that are also good to get, including ferritin. If your ferritin levels are low, then your body is going to have a hard time transporting your thyroid hormones to different parts of your body. And sex hormone binding globulin, SHBG, is another good test. If that comes back high, that's suggesting that your thyroid hormones are being bound up and they won't be able to be utilized by the cells in your body. So for me, this is how to treat intelligently. You get the lab tests, you get all this data, and then you can come up with a game plan on how to treat someone that is having thyroid issues. I also have a website. I'll put a link down that describes all these different tests, what they're for, the ones that are good to do, the ones that aren't so good, to educate you on these different tests. And hopefully you have a healthcare practitioner that's open-minded that will perform these tests on you. My name's Dr. Kerry Tapuzian, and you've been watching How to Treat Intelligently. Take care of yourself.